Appreciate everybody joining us. My name's Darrh Bullock. I'm one of the beef specialists here at the University of Kentucky, and welcome to our UK Beef Management webinar. Tonight we have Dr. Michelle Arnold that's going to be joining us, and Dr. Jeff Lehmkuhler. We're going to be talking about some things that are going on out at the diagnostic lab and some timely tips from Dr. Arnold. And then Dr. Lehmkuhler is going to share some data back that a study that the two of them have done on deworming and so some or parasites. So we'll get into that a little bit later on. But in the interest of everyone's time, Dr. Arnold, I'm not going to go into a big introduction because I suppose most folks know you. You've been on our meetings here on several times on our Shoot the Bull and several other times, and very familiar across the state as our extension veterinarian. And so I'm going to turn it over to you, and I appreciate you joining us tonight.
Sounds great. Thank you, Darrh. So the topic tonight is a timely one. I'm going to talk about grass tetany. I don't know if anybody's yard looks like mine, but I could swear to you the grass grew 6 inches in the last 2 days. I had it mowed right before the rain, and I'm just amazed how fast the grass has grown. And I'm sure it's that way everywhere. So we are really set up perfectly for grass tetany because we've got that lush spring grass. It's very watery from all the rain we had, still early in the season. So that's the time where we see these grass tetany cases. Plus, we've got weather changes going on, and that's when we have this dramatic change in weather and the cattle back off from grazing is when we'll actually see the cases occur. So just to kind of refresh your memory on this disorder, it's usually seen early spring, grazing lush spring grass pasture. It's high in potassium, low in magnesium. Usually it's in older cows. They are less able to absorb magnesium as they get older. It's often in fat cows as well. We usually see it in lactating animals, mostly at peak lactation at 6 to 8 weeks post-calving. Because they lose a lot of magnesium in milk. And some of these cows, we've bred over the years to increase milk production. So their peak production can get up around 30 pounds per day, where it used to peak out at about 15. So they're much more susceptible to this disorder than they would have been before they started to produce so much milk. And the other thing is high moisture grass causes that rapid transit through the gut. So there's not a lot of time to get that magnesium out of the grass and absorbed through the rumen. So this is our cow. Magnesium gets absorbed in 2 ways. There's an active pump that's driven by an electrical potential, and that moves the soluble form of magnesium across the rumen wall. But if potassium level gets high and sodium level is low, that pump doesn't have the gradient it needs to actively pump magnesium into the bloodstream. The other way is passive. So soluble magnesium, if it's at a high enough level that they're taking it in, then it'll flow across the rumen wall into the bloodstream. This magnesium's a little bit different, and there's no mobilization from teeth or bones. It's not under hormonal control. So the body could get rid of excess magnesium through the kidneys, but there's really no pool to pull on if you get a deficiency. And that's why they need that daily intake of magnesium during the critical times. There it is. So how do they get this magnesium deficiency? Either a low magnesium intake, again, cool season grasses, and then all the cereal grains, rye, wheat, oats, are low in magnesium, especially when they're young. Heavy fertilization with nitrogen and potash will reduce magnesium levels. If you have a small amount of clover in the pasture, because legumes have a little bit more magnesium than grass. And then again, anything that reduces feed intake, bad weather, transportation, lack of forage, whatever the situation, reduces the intake of magnesium, can create this situation. There's also times when there's reduced magnesium absorption from the rumen. Again, that high rumen potassium and nitrogen, low sodium. Sodium is critical for transporting magnesium into cells. So they got to have salt. Do have to have salt available. And a high rumen pH will raises the pH, so magnesium's in a less soluble form. So those are just ways that all this can come together to become a deficiency. Remember, grasses are luxury. They have luxury uptake of potassium. This is a problem also with chicken litter. If you have farmers that are fertilizing with chicken litter, those pastures are at really high risk for grass tetany. So bear that in mind. Everybody says, oh boy, it's a cheap form of fertilizer, and I'm certain it is, but there are drawbacks to it too. So be aware of that when you're talking to producers. So what does grass tetany actually look like? So magnesium is necessary for nerve and muscle function, and without it, a muscle will spasm. So you'll see cows staggering with tremors, twitching. That's one of the first things people talk about is they see their skin twitch. They're very alert. Again, tremors, ears are erect. They can stand off from the herd. They can get very aggressive. So this is not a disease where they're going to be depressed or feeling badly. They are really wide-eyed and aggressive. Someone brought a cow to the lab, I guess it was last week, and she had gotten really aggressive and ran into the tractor and hit it so hard that she knocked herself out. So, I mean, they could get really, really nuts. Later, as the deficiency progresses, they can go down, they'll be thrashing, grinding teeth, have seizures, head stretched out, heart can beat almost twice the normal rate, and you can actually hear it, really rapid breathing. So those muscles are just absolutely going crazy. If you find them dead, it's usually a big hole dug around themselves because they've been paddling and seizuring. If you do find them dead, all we need is some eye fluid to diagnose it. So basically, you just take a needle and syringe, stick the needle into the eyeball, and pull out the fluid that's right behind the cornea. And we can keep that, just put that into like a red top tube that we collect blood in. And you can freeze that. If you can't get it to the lab very quickly, you can freeze it because it'll only stay stable about 2 days under refrigeration, but it's stable frozen. But that's the way we can test for magnesium level. And again, this can be really rapid progression, less than a day, from the early signs of that twitching until you find them dead. So the treatment for this is IV magnesium and calcium. That's CMPK. Sometimes it can be really hard to treat these because they're so aggressive. So, if you can get the veterinarian out there, a lot of times they'll use a little bit of sedation just to slow them down where they can actually hit the vein. It is hard if given this solution subcutaneously. It's really hard to get the level of magnesium where it needs to be. Is that magnesium's kind of slowly absorbed, and then it actually has to get into the cerebrospinal fluid and bathe the brain. And so that all is very time consuming. That's why sub-Q is not our best, probably not our best option. Another thing to remember is you don't want to chase these animals. They are out of their mind a lot of times. So you don't want to try to run them somewhere where you can catch them. Just wait until they go down, because chasing them will actually cause them to go over the edge and die. Relapse is common. Even once you treat them correctly, properly with IV, a lot of times they will go back down again. So we want to make sure that we supplement with something like an oral magnesium gel after they've been treated and they've got their swallow reflex. One thing really interesting about magnesium is it can be absorbed rectally. It's one of the few things we know of in cattle that can be done this way. Is you could actually take that magnesium gel and put it in the rectum and give it and deliver it that way. It gets absorbed really well from the large intestine. So Epsom salts, good source of magnesium. Those can be diluted and given as an enema as well. And that's probably actually better than the sub-Q delivery because it does get absorbed quickly. So if you can't find Epsom salts, look for laxative powders. Most of these things have magnesium in them. So what our recommendation is for prevention is supplementing with that high magnesium mineral about 30 days prior to calving. So cows require magnesium daily, or 4 ounces per day of a 12% magnesium mineral mix, especially right now during late winter, early spring, especially if they're lactating. So for the form of magnesium matters. You don't want limestone or magnesium mica, which I'm sure Dr. Lehmkuhler can tell you why. It's probably not my wheelhouse. But this I do know is about consumption of high mag mineral. Cows don't like the taste. It tastes bad. And so I talked to lots of producers who say, yes, I've got that high mag mineral out there, but they have no idea how much they're eating of it. And this is one of the times you need to know. So they're not going to eat the high mag mineral if there's another form of salt out there available. So if they've got a salt block, a white salt block, that's what they're going to eat and not the magnesium. So just because it's out there available it does not mean you're preventing the problem. They've got to actually eat it. So just do a little math with them. That a 50-pound bag, at 4 ounces per head per day, a bag will feed 200 cows for a day. A bag will feed 100 cows for 2 days, 50 cows for 4 days. And you kind of do the math for them. And if you ask producers how many bags they put out in a week or how many bags they put out in a couple of weeks, most of the time they can answer that question. And so then you just have to back figure on the consumption rate. But that's a really, really important thing for producers to remember. I talk to people who feed high mag year round, and I think, well, they must not spend a lot on magnesium, on mineral at all, because they're not consuming much of it. All right, to another form of tetanus that Dr. Lehmkuhler and I dealt with some folks that had some tetanus issues this year. And so just to remind you, for people that ban their calves and that wait and do it when the calves are weighing 400 or 500 pounds, those are the times that they are really at high risk. If they would castrate when these calves are young, under 300 pounds especially, and ban them, generally speaking, those don't have any problems. The problem we run into with tetanus, the larger the testicles are, the larger the scrotal sac is, the longer it takes for that scrotum to fall off with a band. So the longer that thing is attached to the body, the chances of tetanus increase. The tetanus organism wants to live where there's no oxygen. So that scrotum that's got the band around it is the perfect spot for tetanus organisms to grow. Once that bacteria starts to grow, then it gives off that poison, that toxin. And once that happens, it's hard to reverse. So here's where we get into problems, is that the antitoxin, which you can actually give, and it gives some protection immediately, is getting almost impossible to find. There's just not much of it out there. And so that it's really not something we can say is readily available. So we're stuck with the toxoids, which are good products, except they need to be in the animal before castration. So you really want to give the second dose. It's a 2-dose series. You want to give the second dose 2 weeks, or at least 1 to 2 weeks before you do your banding. And I can tell you from experience, that does not happen. I mean, most people just don't get it in twice and then wait before they actually do the banding. I'd say by and large, most people give the tetanus toxoid at the same time they band. It's usually the first dose, and they rarely come back for the second. So back to the case we had not too long ago, I guess it was last week. They had given, that was actually their second dose of tetanus toxoid was given the day they put the bands on. And they lost, I think they lost at least four calves to tetanus. So it does take time for those toxoids to work. And they were convinced it was a problem with the vaccine, but when you start to talk about it, maybe not. It was probably not a problem with the vaccine. It had, they used the same needle for each calf, so all it takes is to get some of those Clostridial spores on the needle, and then vaccinate everybody with that same needle, and basically you've given it, have put it into each calf. So that's a consideration. But the one thing I did tell those producers, I said that the thing you need to do is just start castrating younger, castrate them smaller, and you won't have to worry about this. So certain pastures especially have a lot of those Clostridial spores. If you got horses in the area, they pass a lot of the Clostridium tetany spores. So if you know you're in an environment like that, back up your castrations to when those calves are younger. And there are a couple of products that Covaccinate and Calvary 9 have all the blackleg organisms in it, plus tetanus. So for those who do banding, those are good products to look into, because we have to vaccinate for blackleg anyway. I hope this plays for us. Let's see here. So really, that's a classic tetanus case where they just get really stiff, where they describe them as a sawhorse because those legs get really stiff. Their head is erect, ears are kind of pulled back. But the one thing everybody will tell you about tetanus calf is they have strange looking eyes. They said their eyes look so strange, but it's because there's a lot of the white showing of the eye, and then that third eyelid will flick, and it flicks over the eye. So it's very distinct. And that's one of the very first signs that a producer will notice, is how odd the eyes look in the tetanus calf. And just one other thing, I'm not sure we're going to have any frothy bloat this year. So it's hard to guess. It's really hard to guess when you're going to have one of these years where your calves are at risk for frothy bloat. But it usually occurs in weaned calves, yearling calves, and it's when they're grazing immature legumes or succulent vegetative cereal grain forages like rye and wheat. But it can happen with grass like we have right now too. High in protein, low in lignin, really highly digestible cell wall. Rain on it, if it's wet, it contributes to this disorder as well. So frothy bloat is when a stable foam traps that fermentation gas in the rumen contents, and it prevents the gas from being expelled. So, normally when they ferment their forages, they'll belch. They belch all that gas off. But in a situation with frothy bloat, there's really fine plant particles that cause these bubbles to kind of come together. The rumen bacteria produce a slime, basically, and all that traps that fermentation gas, a lot like the head of a beer. And so they continue to produce the gas, but there's no way for it to escape. So because they can't burp out foam, so it just gets there. They just keep getting larger and larger and larger. And as they do, as that rumen gets bigger, it impinges on the organs, but most importantly, it impinges on the diaphragm and the lungs, so they can't breathe. So how fast does it happen? Sometimes really fast. I mean, it can be death within 4 hours from the time they start to bloat to the time they actually die. It all depends on the individual calf. So it depends on the rate of fermentation, passage rate of the digestive, etc. But it's basically hard to predict is what the bottom line is. I listened to a webinar from an Australian veterinarian. They deal with frothy bloat a lot in Australia. And he said, you really don't know you've got a high risk pasture until you see the dead ones out there. And I think that's probably right. You just don't see it coming until you start to have some death loss. And we've had a couple of frothy bloat years in the last 10 years. I can remember at least 2 that lots of calves died when they were out in pasture. So what are the symptoms? They'll have a big left distended flank, which looks like a bloat. They'll stand up and lie down, kick at their belly, frequent defecation, urination. They'll grunt, rapid open mouth breathing, and really very uncomfortable. So that's a good picture up on the left. You can see this big distended left side. If you can catch them early before they really get into a critical position, you can pass a stomach tube, like this tube down here on the left, lower left, pass a stomach tube, use a product like this on the upper right, which is TheraBloat. It is a surfactant. So it'll break up that foam and allow that gas to be released. If you don't have TheraBloat handy, which I don't guess many people do, you can use mineral oil, you can use vegetable oil, anything that'll break up that foam. And we can deliver that through the stomach tube. And once it's in there, you want to get that calf out and start moving them, walk them, move them around, so that will mix and also bring that bloat down. When it gets into more of a critical situation, you may have to use something like this rumen trocar and cannula, and you actually take that and stick it right in the highest point of that bloat. And then once you get the cannula in, you can actually deliver your TheraBloat or your mineral oil, whatever you have, through the cannula directly into the rumen. Unfortunately, when they get to the point where they're actually down and critical, that trocar and cannula is going to clog up really quickly with foam. So in those situations, really all you can do is take a knife, again, hit them in the very top of the rumen, right here, right there in that left flank, highest point you can find, hit them with a knife, make it a big enough opening you can get in there and actually scoop the foam out. While you're scooping with one hand, be calling the vet with the other, because they've got to come out and lavage that area, get them on antibiotics, and get it sutured back together. But it's a way to save them. It's in a really critical situation, because these do die quickly. Once they get down, you've got minutes to save them. Bloat prevention. They make the bloat guard blocks, which you can offer one block to every 5 head of grazing cattle. There are loose forms you can actually mix in with the mineral. Rumensin is also a good product as far as controlling the amount of fermentation gas that's produced. And here's a nice shot of a bloat on the right. That calf has a big swollen left side. And they say, I put this picture of the white clover. White clover's definitely the highest risk legume, along with alfalfa. But if over 50% of your pasture is made up of clover, those are risky for development of bloat. And there's bloat guard, comes in a lot of forms. It can be liquid. You can get bloat guard that's dry and mix it into the mineral. So lots of different ways to get that product in. But the key to bloat guard, if you use these, they have to have it every day. So it's not like something they can take it in and skip a day. It has to be on board to be effective. So that's where the blocks are a little bit iffy. If they decide not to lick on the block that day, they're going to be without it. So if you're feeding grain anyway, it's a better idea to put the medicated article in the feed. Let me see here. Sorry. Go forward. So recommendations, then I'll turn it over to Dr. Lehmkuhler. As far as our recommendations for producers, avoid grazing cattle on very lush, rapidly growing, immature legumes or wheat pastures. Exceptionally important if forage is wet. And it's hard to get people to do that. It's the best forage there is. They're going to grow the best on it. So it bears watching. When we've got a situation like we do right now with that really rapidly growing forage, that they need to watch cattle closely, and it can be observed within an hour after introduction to a new pasture. But they're more often going to bloat on the second or third day following introduction. So about the time you think you got it made, then problems arise. Slowing the rate of rotational grazing in order to graze the cattle on a little more mature pastures, keeping hay available. Anything with a little more lignin will help with this disorder. And providing cattle with access to anti-bloat blocks, we talked about that, or feed that's top dressed with poloxamine daily. Keep providing a good trace mineral mix, as high potassium and low sodium levels in the rumen are associated with bloat. Kind of the same idea with grass tetany, that high potassium, low sodium is not supposed to happen in the rumen. Providing additional calcium to growing cattle that are on wheat pasture, because rumen and gut motility is compromised by deficiencies of calcium. So that's just another consideration with wheat pasture, is to have enough calcium available. Providing access to clean water, always important. And lastly, growing a grass legume mixture or incorporating bloat resistant legumes is more of a long-term solution to the problem. And we talked about the mineral, making sure they had it in front of them 100% of the time, adequate access. Make sure there's more than one mineral, or at least one mineral feeder per 15 cow-calf pairs. Don't offer that additional loose salt blocks, other sources of salt, because remember that takes away from what they're supposed to have. Okay, so that gets back into our grass tetany discussion. So I will turn it over to Dr. Lehmkuhler for our dewormer study.
All right. Thank you, Dr. Arnold. Going to real quick, if anybody has any questions for Dr. Arnold, you can put them in the chat. I think Dr. Arnold's going to stick around with us, but if anybody has a quick question they want to put in, please go ahead and put that in the chat. And as Dr. Lehmkuhler gives his presentation, I should have mentioned this earlier, you guys can just go ahead and put that in the chat, and then we'll ask it. If we need to take a pause and answer it, we will, or else wait till the end and answer it at that time. So While people are thinking, Dr. Arnold, I was just curious, have you had anything kind of strange coming through the diagnostic lab lately? Anything people should be concerned about?
Um, not not anything unusual as of late. So we had the tetanus case we talked about. Um, but other than that, it's been pretty standard fare. And still, we always get pneumonia. Pneumonia in feeder calves, I think, is a constant. And had some scours. Had several cases of baby calves with scours, and this is kind of the time when you're getting into your calving season or towards the end of it. If there's been any scours problems within the calf crop, these ones that are born later or toward the end are really susceptible. There's just a lot of the bacteria and viruses in the environment, so that's when we typically see problems.
Okay, got a question in for us. Is there any way to determine the difference between frothy bloat and gas bloat from symptoms?
Probably not from symptoms. We can guess at it based on their diet for one, but the best way to determine that is by passing that stomach tube. Is once you pass it down into the stomach, if it's a free gas bloat, whoosh, it's all gone. You'll hear a big rush of gas out the tube, and the bloat has disappeared. So that's the best way.
All right. Well, if anybody has any other questions for Dr. Arnold, go ahead and put them in the chat. But in the interest of time, we will keep things moving. Next, we have Dr. Lehmkuhler is going to join us tonight, and we're going to turn it over to him. So, Dr. Lehmkuhler, you have the capacity to share your screen, I believe.
I do. There was one more question that came in, Dr. Bullock, if you wanted Dr. Arnold to answer
Okay.
that.
So, lost heifer due to blackleg last year. When does that become more active?
Great question. And it's active whenever it wants to be, because those blackleg spores are in the soil, and they're soil borne, and they're also in water. So it's basically whenever they pick those organisms up. There is somewhat of a seasonal component to it, but it's not really one. It's not something we can say, well, it's winter time, we're not going to have a blackleg, because that's not the way it works. It can occur any time of the year. It does seem to be associated somewhat with like a big flood event like we just had. Will wash a lot of those spores up, that are down in the soil. So we get a big rain, flooding event, and the spores will come to the surface. So they'll be exposed to a lot of them. And that's when we tend to see a lot of blackleg cases.
Dr. Arnold, this is also thinking about colostral immunity, and I think, am I wrong that antibodies for blackleg tend to clear pretty quick?
It depends. It depends on the level they get from the colostrum, but actually it'll hang on at least a couple of months. We usually feel pretty confident that they'll hang on till about 4 months of age, and by then they'll start to wane. So you want to start thinking about getting blackleg vaccine in by at least a couple of months of age, 2 to 3 months. I like to see that first dose go in. It varies, but I sure wouldn't want to wait till they're 6 months of age and still not have a shot in them. Because as they start getting into that 5, 6, 7 months of age, that's when we really see a lot of them at the lab.
Excellent. Another plug for Dr. Anderson. He would be telling you guys that's a good reason to have a calving season, so that you can have timely vaccinations for things like blackleg. So another plug for that. All right, Dr. Lehmkuhler, going to turn it over to you. Appreciate you being with us this evening as well.
Yes, glad to be here. Can you see my slides okay?
We got it good.
Excellent. Well, I'm joining you from a hotel room in Texas. I'm down here at the combined Western and Southern section animal sciences meeting, and it's been exciting. We've had 270 scientific abstracts and almost 400 of my colleagues from across the U.S., from as far as Oregon, as far south as Texas, and all the way to the East Coast. Really excited. We've had 5 students. Let's see, we had three students that have presented in graduate work, and then 2 undergraduates presented here. And actually, Samantha Purvis won the Masters 3-minute competition here. So Dr. Bullock knows how proud we are of our undergrads and beef class that go out and give our county presentations. And it's always exciting to see our students come to the scientific meetings and present and do such a great job here too. I'm going to present a little information here this evening on a field study that we conducted through a lot of the help from the county agents who worked with many producers, and some of you may actually be on tonight, and we appreciate all of your support on this. It's looking at internal parasite prevalence and efficacy of our deworming products in the beef herds, and the project was sponsored by Merck Animal Health, and Dr. Gil Myers in Kentucky also helped us out by doing the fecal egg counts. And so when we think about internal parasites, they can really be challenging to our grazing systems. One of the things that we're a bit concerned about is internal parasites have been gaining some signs of being resistant to the anthelmintic products that we have. When we think back, particularly we think back when Ivomec hit the market, that was in the 1980s, and it was in the 1960s for some of our products that hit the market before Ivomec became popular. And so those products have been widely used in the recent NOMS survey. More than 80% of beef producers deworm their cattle at least once, according to that survey. However, less than 6% of the beef producers utilize fecal testing to evaluate internal parasite burdens to know whether or not they need to deworm. So that is a bit of a challenge. And so when we look at some recent work out of Canada to kind of support the concern of resistance to our deworming products, I wanted to share this with you. That was a survey of some beef cattle operations from most of the larger beef cattle provinces. And I just want to point out that when we think about the fecal egg count reduction, there's kind of the threshold set by the World Association of Veterinary Parasitologists that 90% is the threshold. So if we start with 100 eggs per gram, then we want the post-treatment to be down at 10 eggs per gram or less. And when we look at these samples that came in here from this research that was published in 2023, particularly looking, for example, here in the Alberta, where there were 27 farms that were sampled. And if we look at kind of this red and then dark yellow, that represents less than the 90 category. And we combine those groups. There were 37% of those groups that had below that 90% fecal egg count reduction. In Saskatchewan, if we look at, there were fewer farms sampled there, but if we look at those, it was 71%. And then if we look at Ontario, there were 69%. So the point on that I just wanted to share is that, and this is just one of many studies that has shown reduced efficacy potentially in some of our products. And so I'm going to share with you a little bit this evening, kind of some of the additional things to keep in the back of our mind. And we think about immunity. We do know that a lot of our grazing species are exposed to nematodes throughout the grazing season, and many of them will be infected by these parasites. And we're especially concerned about young animals because they seem to be more susceptible to internal parasites. Immunity can be built to internal parasites like Ostratasia and others. However, it takes nearly 2 to 3 years, it seems, based on some of the literature, before animals build sufficient immunity to actually begin suppressing fecal egg counts. And the challenge with that is it's just like any other biological system. Some animals build immunity better than others, while some animals always remain kind of suppressed in their ability to build that immunity. I think it's important to kind of keep in the back of our mind and know some of the stages of the life cycle of internal parasites, particularly when we think about treatment selection. The reason for this is when we think about where these parasites are going to get consumed, it's very similar to a lot of the other things. Dr. Arnold mentioned blackleg, and that's kind of that soil-borne organism, where here pasture contamination is the key route for transmission. And so you have adults that are living within the animal, and these adults then begin to produce eggs, and those eggs are shed out into the pasture, and those eggs then go through and they hatch, develop into larvae. The larvae then advance to basically the stage 3 larvae. They migrate up about 2 or 3 inches on grass, and then the cattle consume those larvae. Once they're in the animals, then they'll advance to stage 4 and then eventually become adults. And so it's important to understand that, you know, some products only work on adults, and so you may clean them out of the adults and fecal egg counts go down, but then because there's these stages back here that will advance to that adult, then you'll get reinfection and shedding again. So it's important to just kind of read the labels on a lot of these products and know a little bit of what they will and will not do. Just to kind of go through real quickly some of the products that we have, or most of the products that we have out there, most of them are going to be in this family, macrocyclic lactones. That includes products that contain ivermectin. Those are your Ivamex and your generic versions of Ivamec. Dormectin or Dectomax, Prenamectin, which is Eprinex, and then also long range, and then Moxidectin, which is your Cydectin. And then we have our white paste dewormers, you know, Valbazen, Synanthic, Safeguard, well, very similar structure as far as the chemical backbone of those. And then we've got Levamisole. Levamisole introduced, I think, in the 60s, and it's the one that doesn't kill that stage 4, only the adults. But the reason I want you to bring this up is it is in one of the new products, Valcor, that is a combination product with Dormectin. And so I think that's important just to keep in the back of our mind that we do have a new combo product that's out there. Just quickly to go through the study, this is the work that actually Amanda Lee, our grad student here, presented at Texas, and I'm going to quickly go through what she presented down here. We looked at collecting fecal samples over 2 seasons, spring and fall. We were targeting 20 samples per farm from the same age group. So we wanted either 20 samples from mature or 20 samples from feeder cattle or suckling calves. Those samples were taken which is on day 0, the same day that they were given an anthelmintic or a dewormer. And then we went back and agents and everybody went back 14 days later to get the post samples. Animals were classed by age, and for our study, what we wound up doing is grouping mature animals as an individual group, and then anything that was a suckling calf up to a bred heifer that didn't have likely a lot of immunity were kind of categorized as growing. We also then recorded the product that was used, and a brief survey of a few questions were also asked on kind of general management principles around anthelmintic use. And so those classes were marked as either macrocyclic lactone, the bins, and or combos. So here's just a quick kind of snapshot of what the prevalence data kind of looked like. And these are just from the pre-samples. So the samples collected the day that they would have been dewormed. And I've got this broken out where we have our fall samples here at the top, and you can see that we did collect quite a bit of fecal samples, and Dr. Myers had quite a bit of a workload going through a lot of these samples. When we look at the mature animals, as we would expect, the fecal egg count per 3 gram of feces was the lowest on average at 11 fecal eggs per 3 gram sample. And then it was 54 in suckling calves, and we didn't have very many suckling calves represented. And then for feeder calves and heifers, it was 106. In the spring samples, we had quite a few more mature animals sampled and not nearly as many growing calves. So you can see that here. The average was very similar in the spring samples at 12 fecal eggs per 3 gram sample, higher in these suckling calves, 194, and then feeder calves averaged 46. So when we look at the prevalence data, so basically what we did is we looked at these samples and then said, okay, what was the frequency of samples that had a positive for stomach worm and Cuperia? Because I could show you we looked at 9 different classes of internal parasites, but the remaining ones were relatively low in prevalence. And so we really want to focus here on Osteotasia or stomach worm and Cuperia. In mature animals, 60% of the fecal samples tested positive for stomach worm and 22% tested positive for Cuperia. We look at the growing animal samples, 78% of those tested positive for stomach worm and 74% tested positive for Cuperia. So we know we have adults in our animals that are shedding fecal eggs into the feces. So that gives us an idea that we do have quite a few internal parasites or quite a few animals exposed to internal parasites. So we look at total fecal egg count reduction. What we've got here is the group of animal class, so mature or growing, and then the product class were MLs, the macrocyclic lactones, and then we've got the BENS products and combo. And combo is where they got, say, a pour-on product plus a BENS, like a white paste dewormer. So this does not include any of the Valcor product because it was not on the market yet when this study was done. This is the number of groups then broken out for each kind of age class and product. And just to highlight this, I think it's important that you keep in the back of your mind, there were not very many adult animals that got the BENS, not many groups that got the BENS, and there actually weren't very many groups in our data set that got just straight BENS, either Synanthic, Safeguard. And then on combos, there were only 2 groups of mature animals that got a combo and 13 groups of growing calves that got combos. So keep that in the back of your mind when you interpret the data, not a lot of groups here. But when we look at the fecal egg count reduction, so this is the percent reduction, and remember 90% is kind of that threshold. For mature animals and for growing animals, they did not reach that 90% threshold, while the other products, either the BENS alone or in combo, reached that 90% reduction or was higher than that. So we looked at this a little bit further, and we actually took the mean of a farm. We filtered the data. Anything that did not have at least 18 samples per age class, and anything that did not have at least 10 eggs per 3 gram sample, we kicked out. And so when we kicked those out, we wound up kicking out about 56% of the groups. And so when we look at that and kind of refine that analysis and look at this a little bit closer, continuing to look at the macrocyclic lactones, we still saw below 90% threshold in reduction for those growing calves. And then we went in and looked specifically at stomach worm and Cuperia by doing some transformation of the data. And we found that for both of those species, they were below that 90% reduction. And so to us, that maybe raises the concern a little bit about this potential resistance then being here. And the reason it's important is Cuperia is known to be resistant, and that is becoming a challenge in some of the other species, like the small ruminants. For sheep and goats, it's known to be a bit of a challenge. So what can you do? I think when we think about these things, our young animals are going to have the highest prevalence of internal parasite and shedding quite a bit. And they're the ones that are the most susceptible. They're the ones that haven't built the immunity. They're the ones that need as much of the nutrition as they possibly can get. And so we need to think about that in regards to our deworming programs. I think you need to really consider working with your veterinarian to develop a monitoring protocol as well as treatment protocols to ensure that you've got efficacy in the products that you're using, and have a strategy to move forward with trying to control internal parasites in these young animals. And so the tools that we really have for that are the fecal egg counts and then the fecal egg count reduction tests. So as we think about new products coming on the market. Unfortunately, I don't know that there's any new products in the pipeline just yet. And by that, I mean, different chemical family that would be something different. So trying to manage the products that we have available to us right now is going to be important. And so the fecal egg count may be a good tool to try to incorporate into your operations to manage internal parasites and treat as needed rather than, say, doing it twice a year. So with that, Dr. Bullock, I'm going to kind of stop there and then open it back up for any last minute questions.
Great. Sure appreciate it, Dr. Lehmkuhler. If anybody has any questions, please put those in the chat and we will get to them. That can be for Dr. Arnold or Dr. Lehmkuhler or anything else, I guess, beef related. And if it's anything else, Jeff, we'll call in Kevin to answer on those. So he can catch all the other category. All right. Any questions? I'm going to put up so just want to make it clear for everybody. I'm going to share my screen for the CAPE. I know a lot of you are wanting to get your CAPE educational component. In order to do that, we don't handle that. It doesn't happen automatic or any of that. There should be a form, the CAPE education form, that you can get either off the Department of Ag website or from your county agent. You have to fill those out. Where the presenter's signature goes, you will put this CAPE code down here, UK worms. And then you need to then get it to your county agent. Your local county agent is who signs that paper to make it official, because it is ultimately up to the county agent to approve any of these educational things. So I hope that's clear for everybody. That's how that process works. So I get a lot of emails after this asking me about giving credit, and all we do is provide the code. Sorry to point that out, but that's our role in this. So looks like we have something. Is long range a good product?
Yeah, it is a good product. We did have a couple of groups in here that had long range in them, and long range, remember, is extended release Aprenex or Eprenex, and it as I recall, when I looked specifically at those, there were some groups that it fell below the 90% fecal egg count reduction threshold. So I'm not sure that it's a product that is going to be any different than the other avermectin groups. And so I think that is something to be cognizant about, and you may want to do some fecal egg counts and even do a fecal egg count reduction test on your farm. Merck will provide the fecal egg count reduction test kits for free. And so if you're interested and willing to collect 20 samples and then send them overnight, there's actually a shipping label that's usually in the box, so shipping is prepaid. And then go out 14 days later after you deworm and collect those samples and send them in, then you can get an idea of the effectiveness of your deworming products that you're using. But I will say that we did have it in our study, a few groups, and it did tend to show kind of a mix. Some did hit the 90% or better, and some did not.
Okay, when should fecal egg counts be done in relation to season of the year?
Oh, I'm gonna ask Dr. Arnold for help on this one too, just as I would tell you all to work with your veterinarian to build that protocol. There's a couple different times a year that you may want to think about just controlling internal parasites in general. And maybe cleaning them out before they go through the winter, so kind of that fall time frame, so that they're not harboring any of those internal parasites as we move into that time frame when we're shifting from, I'd say, a higher plane of nutrition to our stored hay. It tends to be a little lower level of nutrition. Often our hay test quality is lower than the pastures. So removing that internal parasite burden is sometimes a good idea to do before we go into winter. The other thing is macrocyclic lactones, those ivermectin products give you some lice control for a period of time as well. And so we typically will see folks use them then as well. And then maybe coming out and having a clean animal in the springtime, you're reducing the infection of your pastures. Then they're going to pick them up in the spring. And so, maybe a good second time to be thinking about doing egg counts is, sometime in June, late June, early July, after they've been exposed to them, to kind of see where you're at and gauge the kind of counts. So, Dr. Arnold, what's your thoughts?
I think a lot of it depends on what class of cattle you're looking at. Mature animals. It's the jury's out as to whether it's worthwhile to do fecal egg counts on the mature animals, just because adults, especially over 3 years old, they have very low worm burdens. But if you're looking at feeder calves, especially, I think are a class of cattle and replacement heifers that we've got to pay attention to in terms of fecal egg counts, because those are the ones that are going to lose a lot of their production capacity if they have a big worm burden. So those are the ones I tend to watch carefully. I had one producer that I did his heifers, and these were replacement heifers, really high quality, nice looking replacement Angus heifers. I went out and did the pre and the post. And honestly, I got the post back and it was higher. It was higher than it was the pre 2 weeks before when we actually dewormed. And so talking with this producer, he'd used the same product for many years, I think over 10 years. So we had to go back and we used Safeguard actually on these, and we used a pelleted product. So it's one of the nice things about Safeguard is you can get it in a pellet and deworm that way too, because he didn't want to run them through the chute again. And came back after giving them the Safeguard pellets, and I came back in 2 weeks and they were down to 0 where they should be. So I think you got to really pay attention to what are you trying to figure out? Are you especially in those growing cattle, what their parasite burden is, and then you can use that data to come up with your deworming program.
And then just thinking about the life cycle, your life cycle is about every 3 to 4 weeks or so, and it depends a little bit on the weather and that. But those young growing calves, you certainly want to, probably like stockers, you want to think about doing them every 6 to 8 weeks.
Yeah, so, and especially if you use long range, long range catches a lot of people because on the bottle it says it lasts for 150 days, but in reality, it only lasts 150 days for lungworms, but for the stomach worm and all the other ones that we're concerned with, it only lasts for 120 days. So if you actually were to go out and test those cattle after 120 days, say you hit them at 130, you're going to see probably an awful lot of parasites that you weren't expecting.
All right, good answers. Can you do external and internal dewormers at the same time when working cattle?
So there again, as I mentioned, like the macrocyclic lactones, they do control external and internal for a period of time. There is a little bit of fly control with them too. And the other thing is, if you're using, for example, a Ben's product, you can give a permethrin or an organophosphate for external lice control and fly control if you need that. So you can. Dr. Arnold, you got any other suggestions?
So I'm not sure I get the question. Can you do external and internal dewormers? Are you talking about like using a pour-on and like using a pour-on and maybe a white dewormer at the same time, or are we talking about external and internal parasites? So I'm not sure what exactly
I
direction.
think that was I think the question was aimed at the using maybe the porons and the internal at the same time
At the
is
same
how
time,
I
which
read it.
absolutely you can do it. And it's a great way to deworm, to use both products at the same time.
Yeah.
Again, kind of pick your poison there. Pick what group you're going to use that. It's really important, again, in these growing, like yearlings, wean calves, yearlings, replacement heifers. Those are the ones you really got to focus on, doing a great job deworming. And another thing you've got to pay attention to is don't deworm to the average weight. If you deworm according to the average weight of a group, then half of them are not getting enough. So you've got to do a better job or a good job estimating weight, or use a scale.
Yeah, and that's a good point. And so the combos in our groups here, that combo, that was a combination of an oral plus either an injectable or a poron.
Yep, and we got confirmation that that was what he was after. So good. All right, got another one. Good questions tonight, guys. I've experienced high level of face fly pressure in the past 2 to 3 years using a face mop with insecticide and IGR in salt feeders. Other suggestions? Question mark.
Oh, gee.
So I'd ask when the IGR was started. We know that for our area, we need to start the IGR about the second week of March, and most people are not starting it that early. They're usually starting it after the high mag season, and by then we've had an adult fly population already building. So it could be the timing of which the IGR is started.
And Dr. Townsend used to say 30 days before last season and feed it consistently all the way till 30 days after. And remember, that only controls it for you, for your cattle. I mean, the adult flies can still fly in from other farms, and still be a problem. So
the other thing, Dr. Townsend and I many years ago did a fly tag study, and you need to, I don't know how to say this, but you get what you pay for on the fly tags. The cheaper fly tags tend to have a shorter payout period. And so the other thing is you may need to consider rotating the products that you're using.
And he also would say, if you're going to use fly tags and you're having a problem, sometimes you have to use one tag per ear. So you're using two at a time to control the face flies.
All right, excellent. What a night for parasite control. Any other quick questions? You guys put them in. We've kept you a little over an hour. Don't want to keep anybody up way past their bedtime, but if you have a quick question as we're wrapping up, pop it in there. Again, I would like to thank both Dr. Arnold and Dr. Lehmkuhler for joining us tonight. And as a reminder to everyone, this is the last webinar of the season. We will get started back again in the fall. Anybody that's on here, if you got an invitation, you should be registered and signed up. So I think that when we start up next fall, you'll be getting your invitations just like normal. You don't have to sign up for each one individually. You'll get all of them. If you ever want to stop getting them, just send me an email and I can take you off the list. So Dan wrote back and said, thank you. I haven't been starting early enough in the season. So there we go. So now we can get that straightened out. All right, everybody. I hope everybody can stay a little bit dry, but I don't want to wish for too much because we know what that means. And I hate a drought as bad as I do most of the flooding unless it involves threatening of life. So everybody try and stay safe. I hope everybody has a great summer, and we look forward to seeing everybody next fall. So take care.
Thank you.